Participants in the panel session on social minima and captured welfare states considered the challenges faced by Western Balkan countries in the provision of high-quality social protection. It was recognized that the social protection allocations were lower in the Western Balkans than in the EU, as well as that part of the social sector budget was often trapped, which was a slow-to-change practice.
We are here because the cohesion is low, the economic development is low in the region, and people are leaving from the region. If you look on how we spend a little bit less than the EU average member state on welfare state issues. We think that we need a new regional initiative that would try to put welfare states topics back on the forum of development and EU enlargement.
The session moderator, Paul Stubbs, clarified that the concept of social minima entailed a commitment to consistent and comprehensive sustainable social protection systems responsive to needs, securing access to all who need social protection services, and pointed to the issue of clientelistic capture.
Clientelistic capture means that when people with the same needs fall into different categories, those different categories determine the benefits they get, not the needs. Clientelistic capture is when resources, services, and employment is exchanged in return for political support, in the interests of particularistic elites. All right. It is not an issue only of this region. It exists around the world.
In 2012, Western Balkan economies committed to introducing social protection floors in accordance with the ILO recommendation to ensure social protection for all citizens. This commitment was reiterated in 2015 by endorsing the UN Sustainable Development Goals.
This is about a system that will cover everybody, no matter where you are in the system, because that's the duty of any government towards public policies. Now, what we find is this a number of countries, particularly in developing countries, what you find is a significant amount of people in the informal sector that they are not covered by social protection.
I'll briefly just give an idea that there has been a lot of thought put into pension systems that can or should get rid of elements of distortion, which is basically, at least in theory, passing from defined benefit solutions, which was the former Yugoslav pension system, to defined contributions. So that means linking very strongly contributions to benefits, right? What you pay in is what you get out.
In addition to high expenditures on pensions, in some Western Balkan economies, a substantial proportion of the social budget is spent on war veteran assistance.
That leaves very little resources for other purposes, for financing other schemes, primarily traditional social assistance and some child benefits. Benefits for war veterans are, compared to other social groups, are extremely high. And they consume really a large amount of entity budget because of the countries has a fragmented system. The war veteran benefits are basically ensuring that war narrative never stops.
We just did a calculation. If we could spend this 81 million euros that we spent on war veterans and just target the poorest children that live with less than €1.80 a day, you would lift all children out of poverty with 81 million euros, like around 100,000 children. So I think the problem with Kosovo is not that we don't have budget to spend on social welfare. The problem is that we spend in the wrong place.
The participants agreed that, in addition to increasing the funds available, the prerequisites for enhancing the quality of social protection also included their reallocation, as well as further development of social services.
Much more importantly, from my point of view, and I hope that most of the audience here shares, it goes to the management administration of the already scarce resources, and that's the case of Albania. For example, making the linkage with clientelistic and populistic kind of stuff in Albania. We are right in the middle of a heatedly debatable argument as far as it concerns the preventive healthcare services, the famous medical checkup. The cost of this examination for an adult, 35 to 70 euro per year, it's not more than 11 to 12 euro. Yet this opposition, populistic kind of perceptions, mistrust in the system, they are heatedly arguing against this program, which in absolute terms, Albania costs roughly 10 to 11 million euro per year.
Drugo što je pravljeno u prošlih 10 godina je taj klientelizam i socijalni transfer određenim grupama koji nisu bili ni realno proračunati i nisu dali nikakav efekat. To je ovaj parental allowance, znači porodični dodatak, koji je u iznosu jedan od najvećih u Republici Makedoniji, iznosi oko 8,5 tisuća dinara, to je približno 150 evra i uzima se u periodu od 10 godina za svako treće rođeno dete. Od 2005. godine do 2015. bio u 2005. broj novorođenih djece 2%, da je sada 1,5 u 2015. i 2016. Tako da ovako velik iznos novaca uopšte nije dao željeni efekat.
Conference participants were also welcomed by representatives of the European Commission, the PERFORM project of the Swiss Agency for Development and Cooperation, UNDP, ministers in the government of the Republic of Srpska and the Republic of Serbia.
Porazan je podatak za sve nas, bilo da smo u politici, bilo da nismo u politici, da smo u nevladinom sektoru, da je preko 5 miliona ljudi napustilo naš region u prethodnih 10 godina. Podržavam inicijative Centra za socijalnu politiku, jednu i drugu, i nadam se da to možemo zajednički da uskladimo sa vladinim sektorom i da sednemo i da te inicijative i zaključke pokušamo da uvrstimo u naše politike, a ono što je još važnije, u realizaciju toga što ćemo se dogovoriti.
Your initiative comes at a moment when the reflection on longer-term trends and their implications for policymaking is high on the agenda. Just to mention the debate on the future of work as one prominent example. Your conference today is the first event initiated by actors from the region itself. And the impressive program and speakers' profiles demonstrate the research and think tank capacities in the field of social sciences in the Western Balkans.
The conference was organized by 6 think tank organizations and 4 independent researchers as initiators from 7 economies of the region and gathered around 250 key stakeholders from the region and beyond. The conference is only one among the key results of the regional initiative geared towards the areas relevant to strengthening the welfare state in the Western Balkans.